Madam Clerk, would you please call the roll?
Alderwoman Ingrassia.
Present.
Alderwoman Spencer.
Here.
Alderwoman Tyus. Alderwoman Green.
Present.
Alderwoman Martin.
She's excused.
Alderwoman Navarro. Alderwoman Middlebrook.
Present.
Alderwoman Rice. Alderman Todd.
Present.
Chairman Ordinance.
Present.
7 present. You have quorum.
And we will excuse, I'm sorry, I jumped early. Alderwoman Martin and Alderwoman Navarro. And we can excuse Alderwoman Tyus. I think she had somewhere else to go.
So noted.
Thank you. I guess our first order of business is the approval of minutes from Thursday, February the 6th, 2020. If you want to take a second, look at it.
I move we adopt the minutes from our February 6th meeting.
Second.
Madam Chairman, will you please call, Madam Clerk, will you please call the roll?
Alderwoman Ingrassia.
Aye.
Alderwoman Spencer.
Aye.
Alderwoman Tyus. Alderwoman Green.
Aye.
Alderwoman Martin. Alderwoman Navarro. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairman Ornowitz.
Aye.
7 aye votes.
Thank you. So today before us, we have Board Bill number 223, sponsored by Alderwoman Ingrassia. And Alderwoman Ingrassia, if you want to explain your board bill to us, we'll be happy to listen.
Thank you, Mr. Chairman and members of the committee. I'm here before you today on Board Bill 223, which creates a 6-week paid leave policy for full-time exempt employees of the City of St. Louis. It establishes 2 different benefits. One is a paid parental leave for adoption of a child, birth of a child, legal guardianship or foster care placement, and then a caregiver leave policy, which allows for a City of St. Louis employee to take care of someone with a qualifying health issue. Also, that can be for up to 6 weeks, but with a total of 6 weeks for both in the calendar year. Women make up 60% of the workforce in both St. Louis City and St. Louis County governments and are disproportionately impacted by usually being the person who is caring for a child or a sick relative. And research has shown time and time again that this is of little to no cost to employers. It increases employee retention, which can save replacement costs, increases morale and productivity, enhances our reputation here in the community, decreases the use of publicly funded government assistance, and can increase employment rates, which we all know we are struggling with here in the City of St. Louis. And just to speak to the fiscal note that's attached, because we already allocate every employee's salary in the budget each year, it creates a liability on the books, but not a cash expenditure. And so if I have a $50,000 salary and I take unpaid leave, the city just gets to keep that money. Now, if I take that leave, the city will have to pay that salary, so it's already allocated. But it will update the comprehensive annual financial plan, a report that the city releases each year as a liability on a long-term liability on the books. And I'm happy to take questions. I also have Lauren Norton with Generate Health here to speak on behalf of the bill. I'm not sure if you want me to answer questions first.
Well, if you want to, the young lady that signed up on the bill, come up and introduce herself. We'll let her speak, and then we can go back to questions. Is that okay?
Hi everyone, my name is Lauren Norton and I'm an intern at Generate Health. I'm here today in support of Board Bill 223. Generate Health works in the St. Louis region to eliminate racial disparities in infant mortality and maternal health. Paid family leave can have a positive impact on infant and maternal mortality. It would give families the time that is needed to make sure that they can take their kids to their doctor's appointments and give mothers the necessary time to adjust. This gives the City of St. Louis the opportunity to support them in taking care of their families. Black moms and babies are 3 times as likely to die as their white counterparts in this region. We need to create policies and support systems to eliminate this gap, and paid family leave is one of those policies. Paid family leave is a necessary resource for families to care for new babies and sick family members. When families don't have this benefit, they often take unpaid leave, quit their jobs, or go back to work when they are not ready, putting them and their family at risk. Eliminating the burden of having to worry about the security of their job while caring for a loved one will help our families thrive. Having a baby or taking care of a sick parent are all things that are just a part of life. Taking care of a loved one shouldn't come at the expense of paying bills and feeding your family. We look forward to continuing to partner with the city to eliminate racial disparities in infant health. Thank you.
Okay, thank you. And then if you want to stay up there, I'll ask the Alderwoman to come back up, and we'll go down the list if someone has any questions, if that's all right, of either one of you.
Sounds good.
Alderwoman Spencer?
I have no questions. Thank you, Mr. Chairman.
Alderwoman Green?
Thank you. Quick question. Just reading that it is incumbent upon to get paid leave, they must provide the city with not less than 30 days' notice.
There's an exemption for that. Yeah,
Okay.
that's ideal, but not required.
Okay. 'Cause I just know that I've had some friends who've gone through the adoption process, and they often don't know until
Yeah, I think
couple
if
days
Can you
before
let me
that
know
it's-
what page you're on? Because it's in the same paragraph.
page 6,
And which line?
line
Line
14.
14.
Yeah.
Right, and it says at the end that if it's not possible, that the employee shall provide such notice as is practicable. I think the idea is what other cities have experienced is if they just have a heads up that something might be coming down the pipeline, they have the ability to
Okay.
prepare.
Okay, so if they know that they've put in to adopt and they're waiting on their date.
They know they have
or
a C-section
whatever.
date, or
Yes,
obviously,
okay,
things
Okay,
probably many times do not happen that way.
yes. A lot of people don't know what's happening in 30 days.
Right.
so, Okay, just wanted to be clear on that. And then the other thing is, I thought I'd requested to be a co-sponsor, but if not, please add me.
Yes, you are online, and I
Okay,
did,
but not on the bill. Okay. So please make sure that my name's also on the bill. Thank you.
Noted.
your support.
Thank you. Alderwoman Middlebrook?
I have no questions. I, too, believe I was a co-sponsor.
You are online as a co-sponsor, but not on this draft, so I apologize, and we'll make sure that you are on there. Thank you for your support.
Quit.
Alderwoman Tyus, I don't know if you had a chance to read the bill or not. I'll come back to you if you'd like.
I did, because I'm a co-sponsor.
Okay,
I'm sorry, I'm a
so-
co-sponsor. I did have a question. Sorry I'm late. The Board of Freeholders is taking up all of my time. So I wanted to know, why are we calling it parental and caregivers? I thought we were going to have a family leave that kind of put it all under the same umbrella, and what happened with that?
I mean, it is. I think it's just a technical term, so it's definitively creating 2 programs. One is
Right.
for parental leave, and the other is to care for a sick relative.
So do you ever see this being, because I guess I was, and I'm, have it, everything, the maternity, everything under one thing and call it family leave, so that whatever we add to it, if we, in the future, we decide whatever else we need, just make it one thing, and that people could use the time interchangeably, because if people don't have maternity leave, but they may have adoption leave, or,
The bill does
Right, that's-
provide for you to be
I know.
able to use it interchangeably and also use it in increments of a day, as little as a day.
right.
But yeah, I mean, I'm happy to discuss that as a possible floor
But I'm saying
sub.
that if you added maternity too, so,
It's
I beg your pardon?
Maternity is in here.
Okay, I must have
It's
missed
provided
that,
for,
okay, 'cause-
and so is stillbirth. Let me find it for you.
I don't have this bill. Here's the bill right here. Okay,
It's on page 5.
okay, all right, she showed it.
Okay, good.
Thank you. I have no further questions.
Thank you.
Thank you, Alderwoman. Alderwoman Rice.
I don't think I have any questions again, and I'm really grateful for all of the work that you put in to bring this forward, and all of the work of our departments, Gerard and others, and looking into other cities' best practices, and I think this is a great step forward for us, and that we're both providing for childcare, for birth, adoption, all of that, and also this, the caregiver that, aging parents, and especially in a society where we are not caring very well for our elderly relatives, that we have this built in. So thank you so much for bringing this.
Thank you, Alderwoman. Alderman Todd.
I think it's a great bill. I would like to be a co-sponsor.
Thank you for your support.
Alderwoman, I believe everything looks pretty well in order. I agree with the bill. I just didn't know if this was something that needed to be passed through the Civil Service Commission, but we're doing it basically through the pay ordinance, pay bill.
This will go into effect and be incorporated into the payment compensation bill that we pass each year.
Okay, again, I appreciate, and I really appreciate you being early today. That means a lot. I know you're a busy person, so.
Sure. Do you mind if I just close quickly?
Sure, go
Thank
ahead.
you.
Take your time.
I just wanted to thank Generate Health, the Women's Foundation for St. Louis, Alderwomen Rice, Navarro, and Martin, Gerard Hollins, our financial analyst, and the Personnel Department, Richard Frank, because they were all, and Paul Payne, the Budget Director, they were all very helpful in getting this work done.
Thank you. Could you also add my name as a co-sponsor? Thank you. So if there isn't any more questions, I would entertain a motion to pass Board Bill 223.
So moved.
To pass recommendation.
So moved.
So move.
Second.
Second. Previous row? Oh, that's right. I'm sorry.
The minutes.
Madam Clerk, could you please call the roll?
Alderwoman Tyus. Alderwoman Spencer.
Aye.
I'm sorry, I said Tyus. I'm sorry, let's start over. Alderwoman Ingrassia.
Aye.
Alderwoman Spencer.
Aye.
Alderwoman Tyus.
Aye.
Alderwoman Green.
Aye.
Alderwoman Martin. Alderwoman Navarro. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairman Ornowitz.
Aye.
8 aye votes.
With your vote, we have successfully passed this board bill out, and at this time, I'll entertain a motion to adjourn the meeting.
I move we adjourn.
Second.
Meeting's been moved and seconded. Previous roll.
Okay, thanks, Gerard.